Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This is the final episode in our three-part series on relapsed refractory mantle cell lymphoma. New therapeutic options mean that cancer care can be more personalized than ever, but it also means care teams must have effective communication with patients, so everyone is in alignment with the goals of treatment. We look to our guest today for tips on how to navigate that with patients and their families. Dr. Jeff Sharman is the Medical Director of Hematology Research at Sarah Cannon Research Institute in Eugene, Oregon. Dr. Sharman, how do you approach treatment for this patient population?
When a patient's been diagnosed with relapsed mantle cell lymphoma, these are patients who've had prior therapy and now their disease has come back. And what we like to determine when that patient's in front of us is how much disease they have. So oftentimes we're getting CT scans of the chest, abdomen, and pelvis. We would like to know how symptomatic they are. So the history is very important. And of course, we would consider how long their disease was in control from their first line therapy and their age, performance status, and functionality.
Are there any specifics that providers need to be aware of in the community setting?
When a patient's diagnosed with relapsed mantle cell lymphoma and we're considering treatment, we like to know if they have TP53 mutations, because that's going to set some expectations for how long their disease is going to be able to control with subsequent therapy. And of course, we like to know how long they responded to their initial therapy, but also considering their age, performance status, function will influence some of the treatment decisions that we make.
How do biomarkers influence treatment strategies?
Patients who have TP53 mutations are not going to get as much benefit out of any therapy compared to patients who lack TP53 mutations. Now, in CLL, a disease that's similar to mantle cell lymphoma, we're accustomed to sending FISH, and FISH can be useful in mantle cell lymphoma, but it's really the TP53 mutations that have such uniquely bad prognosis. So I like to know that for my patients. It is something that can change from their first line therapy to their relapse setting. So getting that test can be useful so that we can begin to set expectations for how the next therapy is going to work and consider what therapies may be most suitable for a patient.
How important is patient education here?
Patients are going to have variable expectations coming with relapse disease. Some patients who are highly educated may know the latest and greatest regarding the most recent CAR T-cell approval or experimental bispecific antibody. Many patients are older and are not as familiar with web-based resources and may simply come to our appointments asking, "What's next, doc? What do we do next?" And regardless of their education status, we need to be able to be prepared to recommend the optimal therapy for that patient.
How do we establish treatment goals with patients in this setting?
When we're establishing goals of therapy, I think that clinicians oftentimes have an intuitive sense for what a patient may or may not be able to tolerate. And when we say tolerate, we're thinking about the toxicity profile of the various therapies. Fortunately, treatments such as BTK inhibitors are generally very well tolerated by patients, and there are very few patients who can't take a BTK inhibitor. But as you go up the scale of increasing intensity, such as CAR T-cell or even allogeneic stem cell transplantation, those are therapies not suitable for patients with more extensive comorbidities. So when we're going about the process of establishing goals, a lot of it has to do with our perception of what a patient is capable of tolerating.
What about collaboration between large academic centers and community cancer programs? Does that increase access to therapies?
Mantle cell lymphoma is not a common diagnosis, and some physicians may only see one or two a year, if that. And so it does help to have a partnership with a larger academic institution that's familiar with a number of the latest developments in the field. And I think that a collaborative relationship between a community practice and an academic center can be of considerable benefit to a patient, so that as treatment decisions are made, that both the physician and patient can feel like they're offering the patient the very best therapy.
Thank you, Dr. Sharman. You can take a look at the show notes for more information on relapsed refractory mantle cell lymphoma. And while you're there, make sure to check out the other episodes in this series. Until next time, from all of us here at Cancer Buzz TV, thank you for watching.